Hi, this is Dr. Beltre from Beltre Bariatrics, and there's a big difference between getting your bariatric procedure done through the insurance versus paying out of pocket. So when you go into the insurance, as you know, most insurances require, of course, psych evaluation, which we also do, nutritional consultation, of course, as well. But then also most of them want proof of an attempt at a weight loss program that you have done in the last 2 years. So if it's something that you did 3 years ago, they're not going to take into consideration. It has to be something you've done in the last 2 years and that you did under a supervision of a physician. So if you did a weight loss program with your doctor and you went month after month and consistently, by the way, you cannot skip any month, and it has been documented, then you can use that. We use that to send to the insurances and to get you approved. By the way, you should do this weight loss program for at least 6 months. Some insurance 4 months is fine, but most of them is 6 months. So 6 months of a weight loss program. So sometimes you need to wait at least 6 months to finish a weight loss program before you can send this proof to the insurance that you did it, and that hopefully they will consider you for approval. Although you might do everything correctly, they still might not approve your procedure. So it is really a pain, sometimes a waste of time to go through the insurance, versus when you're paying out of pocket. When you're paying out of pocket and have your surgery done at an outpatient surgery center such as ours, yes, we do require the site consultation, the consultation with the nutritionist as well. But there's no weight loss program requirement. Okay, there is a pre-op weight loss diet that we do that can last anywhere between 1-2 weeks to up to a month or two, depending on the size of the individual. But most patients can have their surgery done within 2 weeks of their initial consultation. So what are the steps? Number one, you require a consultation. A consultation can be in person. You come to our office and you are seen by myself or by one of my other providers. During the consultation, of course, we look at your medical history, we look at the procedure that you're thinking of having done. We make sure that we agree with that choice, because some patients might want a procedure, and we might say, well, you might do better with this one versus the other. Or you can have your consultation virtually. We do virtual consults. I do have patients that come from all over the United States. Although we're located in Florida, I have patients coming from North, New York, Boston, Philadelphia, and Midwest. So we have patients coming from all over. And these patients, of course, we do their initial consultation is done virtually. And the same way with the virtual consultation, we look at your medical history, we discuss the procedure that you want to get done and make sure that we agree with that procedure. Then we ask you that you do your consultation with the nutritionist and the psychologist, of course. With the consultation with the nutritionist, she's going to be teaching you how you're going to be eating, how your portions are going to be after the surgery. And then the little changes that you need to make in your dietary habits to have the maximum weight loss, okay? So nutritional consultation is very important. In fact, I tell my patients to continue seeing the nutritionist for at least 2, 3, 4 more times after the surgery until they feel that they have changed the dietary habits. So, and that way you have someone else besides us holding you accountable for the weight loss and making sure you're doing things right. The site consultation is to make sure there's no food addictions, drug addictions, any active psych issues that need to be treated. So that's the psych consultation. Then after the psych consultation, we do get some labs, of course, make sure there's no deficiencies, make sure there's no anemia, things like that. And we require a medical clearance. The medical clearance, basically, you go, if you have a medical doctor that you've been seeing, we work with your medical doctor so that they can do the clearance for you. It requires an EKG just to make sure your heart is healthy. If you see a cardiologist, we make sure that you get a consultation with the cardiologist and a clearance by the cardiologist. If you do not have a medical doctor, we do have medical doctors in our practice that can do your clearances. But in cases like that, if you're not in the area, you have to make sure you come in a day or two before your surgery to make sure everything is done right. So, and some patients that are coming from far away, they don't have a doctor, they're otherwise healthy, they don't have a doctor, we can do the clearances and the labs here as well. And then when we get this done, then you need to start your pre-op weight loss program, right? The pre-op weight loss program, like I said before, can last anywhere between a week to 6 weeks, depending on the size of the individual. I do operate on very large individuals sometimes, and these patients require a little bit longer on the weight loss program, maybe up to 6 weeks. However, I would say 90% of patients can have their surgery done within the first 2 weeks after the initial consultation. This pre-op diet basically consists of a protein shake, and we instruct patients to the protein shake that we would like them to use. And you will replace 2 of your meals with a protein shake. For example, for breakfast, do a protein shake, nothing else. For lunch, you do another protein shake. And then for dinner, for example, you can eat as much lean meat, fish, chicken. If you want to, with your veggies and salads, so no rice, bread, pasta, cake, cookies, no sugary drinks, anything like that. Sometimes we tell patients that they can make lunch their heaviest meal, where they have the solid meal, and then for dinner they can have a protein shake. So that's the pre-op weight loss program. Once it's done, then of course you can have your surgery. You can have your procedure, whether it's a gastric sleeve, a gastric bypass, or a duodenal switch, or a revision. We do a lot of revision, band removals, band to sleeve, band to bypass, and so on. You have the procedure done at our surgery center. Our surgery center is an approved surgery center in the state of Florida. The procedure can last anywhere between 30 to 45 minutes if it's a gastric sleeve, up to 2 hours if it's a duodenal switch or a gastric bypass. Then after that, you go into the recovery area. You stay there for anywhere between 2 to 6 hours until you are fully recovered. A lot of the patients are walking around the hallways, going to the bathroom by themselves before they go home, and you get discharged with instructions. You get discharged, however, we see you 2 to 3 days later. So for example, if I do your surgery on a Monday or Tuesday, you will follow up with me on Thursday. If I do your surgery on Thursday or Friday, then I'd see you Monday, despite the fact that we do give you that call. So we follow you very closely the first couple of days. If you're coming from outside Florida, I normally tell my patients to plan to at least spend about 4 or 5 days in Florida. So that to make sure that when you go home, you're fine and everything, and you are well into your healing process. So I hope this was of help. This is the process that we use compared to the insurance, which can take a little bit longer. It can take months, sometimes it can take years, because sometimes they deny you and then you have to kind of go through the whole process again. So we have Beltre Bariatrics in the Orlando area, Orlando, Florida. We've done almost 2,000 procedures at our center with excellent results. So I hope it was helpful, and we look forward to working with you in the future. Thank you.